Hello and welcome to the EDU-TALK series hosted by Biotone, Biotone EduPartner Program, and massage industry experts. With the growing interest and popularity of the EDU-TALK series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Sally Spurgeon, a board-certified massage therapist and certified lymphedema therapist. Plus, Sally's a breast cancer survivor. Sally developed the Spurgeon Method with the goal of training therapists to provide relief, recovery, and well-being to mastectomy and clients concerned with breast health. She's offered since 2011 both breast and post-mastectomy massage and training. Let's listen and learn as Sally shares how massage therapists play an invaluable role in helping clients promote and maintain healthy breast tissue, bringing clients awareness of the changes in the tissue and the lymph to provide relief from swelling, pain, and limited range of motion often experienced during recovery from a mastectomy or other breast surgeries. We have a lot to get to. Sally, welcome. Thank you for joining us. This is going to be a great topic. I know you have a lot to cover. And I will turn it over to you and see you on the other side. And before I do that, feel free to chat Sally questions and comments during the presentation, which she will answer at the end. And Sally, with that, it's all yours.
Thank you, Janelle. And thank you to Biotone for this series. So I am going to share my screen here, hopefully. And hope everybody can see that okay. All right. So I am a massage therapist. Let's go back to where we start here. Get this right. So I am a massage therapist. I was diagnosed with breast cancer in 2008. I had literally just opened a massage office, deciding that in my new incarnation here in retirement, I was, excuse me, going to do massage, and was absolutely blown away to get a diagnosis of breast cancer. So I went through treatment through 2010. I had chemotherapy, I had a double mastectomy, and I had reconstruction surgeries. As I just opened the office, I really needed to keep it open. So I did keep working through all my treatment. And I was really fortunate in that I had two amazing surgeons, Dr. Anne O'Neill, who did my mastectomy, and Dr. Kevin Kiobani, who did the reconstruction. And I, going through all this, had other therapists at the office who were working with me, and I really felt what my body needed. And they were able to help me get through this. And the two doctors allowed me to watch them perform surgeries. So I really got a good grasp of what was going on and how to help other people who I met in my doctor's appointments who were really not doing as well. So if I'd never received this diagnosis, I may never have known what women go through when they have to go through breast cancer treatment. And I actually did so well with this that my surgeons asked what I was doing and could they send their other patients for the same treatment. And I had no idea what to call it. And so Dr. O'Neill said, well, what are you doing? I said, it's just this method of combining different techniques and it brings results. So she said, okay, it's the Spurgeon Method. And that's what she started sending people for. We did that for a few years. And then I had a visit from the director from the Chopra Center, which is in Carlsbad, California at the time. And they had me go there and teach all of their medical staff and their spa staff how to do this technique. And they added some marma points to it. And we're actually providing this as Ayurvedic breast massage at their center for years until they closed right before COVID. So it became quite a thing. We've had a lot of people ask about it. And again, they've really helped to promote it and helped so many people in their post-mastectomy journey. So typically, when somebody mentions massage, they're not thinking about breasts. We all know that massage can do so much in terms of reducing tension, improving circulation, and many other benefits. But I was always told, never touch the breasts, and I'm sure many of you were too. But it is so important that we do. But when I mention breast massage to someone, I don't get quite the same reaction as I do when I say, would you like a massage? Get this very skeptical look for many reasons, and we'll get to those. But it has the same benefits and then some. So all of the above as for a regular massage, but it can also promote healthy breast tissue. It can help to maintain the shape of the breast. It's a great healing technique for tendons.
TV, a baby chimpanzee makes her debut with her mom. Did
or
you see
aching
that?
breasts.
Look at this. Oh.
It helps with milk flow, can open clogged ducts, and can help to break up benign cysts. And I'm sorry, I'm having a hard time talking over somebody else talking. It's a great way to get familiar with breasts in order to detect any irregularities. And we all have them. Every person is born with mammary tissue. And this part of our anatomy needs as much, if not more, attention than the rest of it. The personal, emotional responses that we have to breasts are woven together with popular culture and media-driven imagery, which has really skewed our view of breast massage, especially here, actually also in the UK. But in other countries, when I lived in France, they thought nothing of including it in a full body massage. We need to include this. We need to really think about breast health. 1 in 8 women currently will develop breast cancer in their lifetime, and 1 in 877 men. It's really increasing. The incidence of breast cancer in men is increasing. It was over 1,000 last year. Now it's already down to 1 in 877. So men have to look at this too. And it is such a really important part of our anatomy. It's also a very complex part of our anatomy. Our mammary gland have ducts, lobules, the lobes, and it serves a really, really important purpose that oftentimes we overlook that, but it has one purpose, and that is to ensure the continuation of our species. So keeping them healthy is beneficial for everyone in the long run. So I always think of breasts as this big blob of fascia that contains all the lobules and the lobes and the ducts and all of the functional anatomy that's contained therein. Fascia reminds me of this big sponge that has holes and channels that go through it. And our lymph vessels, our blood vessels, and our nerves all go through this network. If it becomes dehydrated or injured, inflamed in any way, then that tissue tends to get dehydrated. And I always think of the sponge that then clamps down on these vessels, and then they're not able to function properly. So it is vital that they do, because all bodily tissue, including the breasts, is kept healthy by function of our lymphatic system. And lymph is typically moved in 3 ways, which is respiration, muscle movement, and manual manipulation. So if we're not breathing deeply enough, we don't move enough lymph. Most of us don't breathe properly. Muscle movement, so exercise is very important to move the lymph, and manual manipulation. If you're not actually massaging the breasts every day, then they're not getting enough manipulation to move the lymph. Breasts don't have muscle. They lie on top of the pec muscle. So again, if you're not moving this tissue every day, it's not getting enough attention to move the lymphatic fluid. So breast tissue, and therefore lymphatic tissue, is often constricted by a bra. And I'm hoping everybody, if you wear a bra, you take it off and you massage your breasts every day afterwards. But gravity can also cause large pendulous breasts to have insufficient lymph flow through the nipple and areola, and that can be a problem area for people with large breasts. Congestion causes dis-ease. So massage can help to restore ease to the breasts by moving fluid, which softens congested tissue and allows the lymphatic system to function properly. So therefore, the breast tissue stays much healthier. These lymph nodes and vessels are pretty diffuse throughout breast tissue, and breast tissue probably extends further than you think. The boundaries are all the way up at the clavicle and sometimes past it, all the way down to under the breast, which is the inframammary fold, as far out to the side as your shirt seam and sometimes a little beyond, and then to the sternum in the center. So everybody has varying amounts of breast tissue, but I think it is important to realize just how extensive that is. So make sure that all this area gets attention and the lymph gets moved there. So most of the lymphatic fluid from the breast drains towards the axillary nodes. So most of it is going to go towards the underarm. Some will go to the sternum and some will go down to the abdomen, and most of it will go from superficial, so here, to deep, to the deep area behind the breast tissue. Daily self-massage and professional breast massage can promote healthy tissue and help to detect any changes. If you look at the picture on the bottom right there and you see how diffuse that area is, that's all lymph. So not only is it hard to really know where the lymph is in the breast, it's also hard to know exactly how many nodes are there or how many have been removed. If somebody does a lymph node dissection, it's hard to know exactly how many nodes are in there. So what keeps someone from getting a breast massage? It is so vital for the health of our breasts, but some people don't understand the importance. And so don't know about it. Like, I had no idea about a lot of this until I got breast cancer. So most people don't really seek it out, I think. Maybe it's not available. In some areas, breast massage is illegal, or it's hard to find a qualified therapist. Breasts are very sensitive areas, so both physically and emotionally. For some, even the thought of someone else touching their breasts can be really uncomfortable and unnerving. Some people may have had negative past experiences with breast touching, such as sexual assault or abuse, and this can make them feel very anxious or even fearful about getting breast massage. And if someone's never had a breast massage before, they may not know what to expect. This can lead to feelings of uncertainty and anxiety. Then in some cultures, breasts are seen as taboo or as private areas, and this can make people from these cultures feel more uncomfortable about getting a breast massage. If someone's going to offer breast massage, it's really important that they explain to the client what they're going to do, how they're going to do it, and what's involved. The biggest fear that stops someone getting breast massage is fear of finding something ominous. Everybody's afraid of finding a lump in their breast. But we all have them. Pain, lumps, and bumps. These are a natural process as we age, and most are nothing to be overly concerned about. But breast monitoring by self-examination and by a medical professional is always advised. If you get a baseline, then you can go from there, and that will allay most fears. These all occur naturally as part of the involution process, which is what happens during menopause when the functional tissue, all those lobes and lobules that we looked at, turn to fat. And this usually starts around or just after age 35. So the lobe structures are replaced by dense collagen, which then turns to fat. Sorry, that's why they all go south as we get older. Cysts can occur, which may or may not cause pain, and these are a normal part of this process. Cyclical and non-cyclical mastalgia accounts for approximately half of breast-related medical consultations. And there's a bunch of other non-cancer symptoms that can appear, and these can result from ductectasia, a lipid cyst, intramammary lymph node, sclerosing adenosis, mastitis, scar tissue, hematoma, abscess, prominent rib, calcification, fibroadenosis, and fibroadenoma. And these last two cause all kinds of problems for people, but they are quite normal. In fact, fibrocystic changes are the most common benign condition of the breast. And these can be painful. Oftentimes it will need needle aspiration, and there can be a straw-colored or green fluid that comes out. And a fibroadenoma can be very worrying because it's typically a painless, well-circumscribed, round, mobile mass. And somebody finding that in their breast is going to be concerned. But it's a benign solid tumor that contains glandular and fibrous tissue. A core biopsy may be recommended, and that can be followed clinically, or it can be surgically excised, depending on how uncomfortable it is. So all these things happen normally. It's part of our aging process. So self-breast massage really is an easy way to monitor breast health. If you just do a simple daily routine, I recommend in the shower, quick and easy, just to encourage lymph flow through the tissue, and then check for any changes or irregularities as you do it. And of course, another way is to ask your massage therapist to include breast work in your session every month or as often as you do it. But self-breast massage, especially if you put some kind of balm or something that you're going to rub into the tissue, you'll notice if anything feels different underneath. Or you could always get a professional breast massage. As with any other type of body work, a therapist performing this work needs to have the right licensure and training, and always needs consent. The relaxing environment of a massage office can make a client feel safe and reassured about receiving breast work, especially if they're a regular client to whom the benefits have been explained. Breast work can easily be incorporated into a full body massage and is in many countries. Never, 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 never offer and perform breast massage on the same day at first. Give the client time to think before consenting, unless they've been referred by a physician for breast work. We have a lot of surgeons, not just oncology surgeons, but also plastic surgeons who refer their clients to us at my office after reconstruction, because there can be after augmentation, or reduction, because there can be a lot of issues that show up then. And as a therapist, if you let a surgeon know you're doing this kind of work, oftentimes, because there's not that many people doing it right now, they will send you their patients. It's a lot easier for them to have pain managed by a massage therapist than it is for them to be put on pain meds to try and cope with something or to have more surgery. So you can be very effective at helping these clients. But always, always, always obtain specific written consent from a client before performing breast work. So check your state rules and regulations before you offer the work. In the handouts that you get at the end of this presentation, I have given you a sample of what we use here in Nevada. So you can always, if your state doesn't have one at this point, you can always modify that and submit it, and perhaps they'll accept that. We've actually had that done in a couple of states. So always get specific written consent before performing this work. Clients will more often talk about fears and concerns to their therapist than they will to their doctor. A therapist may notice a change before a client notices it themselves. This happens more often than I'd like it to. but it does happen. So keep notes from every session, as you probably do with clients anyway, but keep notes on the breast. It gets divided into quadrants, and you can easily chart where you notice an area that needs to be observed. You can indicate a change or irregularity that may present. And then if one is discovered, you can refer them to a healthcare professional. So keeping a list of healthcare professionals at hand to refer to or for imaging or consultation can be very helpful to a client, and also establishes you as a professional if they know that you really do understand the process of finding something and then what to do. Again, the sooner something is found, the sooner it can be treated. And of course, the much higher chance of survival and not such an unpleasant treatment course. So do you know what to look for? This app, if you're not already familiar with it, I found to be one of the best icebreakers when approaching this subject. If you show somebody this app, which you can easily download, it shows the 12 symptoms, 12 signs of breast cancer. So if you're not familiar with this, I highly recommend that you download this, or you can go online to knowyourlemons.org. Check it out, share it with your friends, your family, your clients. I have lost count of the number of women who report. There's a chat attached to this app. The number of people who've reported that they shared this and somebody found their own breast cancer by using this app. So it really is a very helpful tool. You can actually become a lemonista and teach about it too if you have time. It's needed. Breast education on these signs and symptoms is really needed. And what if somebody actually finds they do have breast cancer? There are so many emotions that accompany a breast cancer diagnosis. Mine was disbelief, but a lot of women are immediately fearful, depressed, and they tend to isolate. You need people around you when something like this happens. And I feel for the people who cannot tell someone that they've had the diagnosis and that they're going to face treatment. Patients are more often concerned about the physical and emotional toll on their loved ones than they are on themselves. Many put on a brave face and stuff the fear and overwhelm of the diagnosis out of concern for others. And yet some still need someone to talk to cry with, or to be touched by. A massage therapist can provide a safe space in which a client can drop the facade, release their emotional and physical tension, express their fears and concerns, and gain strength and resilience for the journey ahead. Something so nurturing and so strengthening about being able to go in for a massage session and just tell your therapist everything that you're concerned about, and then leave that. You feel so much, a load shared, right? A burden shared is halved. You feel so much better having got it off your chest, literally. And then you can move on and face what's ahead. Massage therapists really, really are invaluable at this time. But if you are going to offer this work, then oncology massage, energy work, and reflexology are all recommended treatments for clients facing a cancer diagnosis. Such great tools to have in your box. If somebody does have that diagnosis, then what's ahead really is a little overwhelming at first. Treatment, surgery, what's next? So surgery options, depending on the cancer, the size, the location, the type, could be a lumpectomy, mastectomy. There's 5 different kinds of mastectomy, lymph node removal or axillary lymph node dissection may happen. Could just be a sentinel lymph node dissection, and then reconstruction. If someone is pretty small chested, they could just have an implant alone, and implants are typically silicone or saline. If they're a little larger, they're going to need a tissue expander first. That's a silicone casing, and then they fill it gradually with saline to the size that is one you're happy with. And then that gets removed and it's followed by an implant. And then there's a whole bunch of flap surgeries. So really depends on your body type and your surgeon and what is needed to reconstruct the breast. And most people going through this will have chemotherapy. It's, again, depends on the cancer type. Chemotherapy, and some will have radiation. So they have a lot to think about, a lot to go through. And if somebody's had breast cancer surgery, which typically they'll do chemotherapy first, do the mastectomy before the mastectomy, because they try to shrink the tumor. Not always the case. And then radiation, and somebody facing radiation is going to have to lift their arms up above their head. They have to get in position for the radiation, and that's not always easy if you've already had surgery. It's really, really not a comfortable environment and not a great time to go through, but massage can help. It's actually been proven that massage during treatment can reduce pain, alleviate stress, relieve nausea, reduce depression and anxiety, improve sleep, and lessen fatigue. And it provides someone to listen without attachment. So very, very important. And if somebody's facing mastectomy surgery, it's so traumatic. So just to be able to relax like this first it's nurturing and it's needed. So mastectomy surgery, it's not pretty. And there are big scars. We've had clients come in that don't want to take off their bandages because they don't want to see what's underneath. But if the wounds have healed, then you can work with these clients. Typically, once this heals over and the drains are removed, it's important that the drains are removed before you start working with these people. But once that's out, if somebody's going to have expanders, then those go in next. Actually, those often go in at the time of the mastectomy. It really depends on the presentation. Everybody's different. But oftentimes then they will put this expander in place, which goes under the muscle. And then there's typically an allograft. So there's some tissue that's put in that attaches to the bottom of the pec and then to the inframammary fold. And that just makes room for the expander to go in and for the implant that follows. So this goes in, it gets filled little by little until you're the size you want to be. It gets taken out and then an implant is put in place and you end up with new breasts. So there can be some pretty big scarring. The one in the center there still has tape over her scars in this picture. And the position of the scar can be in different places, depends on the surgeon and where the cancer was and the method of the surgery that was used. But if you look at top right, that is where somebody's had their nipple and areola 3D tattooed. And she's very happy with her outcome. She came out very nice. Flap reconstruction gives us a lot of areas to work with. So two different kinds of flaps. A free flap is the actual removal of muscle, which is then relocated, or a pedicle, which the artery and vein are left intact, and then they're brought up under the tissue to a new location. So on the right there, this was taken from the abdomen. A flap was made, and you can see the two different flaps on the breast there where the breasts were reconstructed. And on the left was a lat flap where the latissimus muscle was used and brought around. And that scar is usually under the bra line. So if you haven't seen or heard of the SCAR project and you're interested in this kind of work, you can look it up online. I donate to their organization, and I have their book, because to me that was such an eye-opener, reading the stories of these women and what they'd gone through. It's really is an amazing project that David J. created. As you can see, there's a lot of scar tissue there, which gives you a lot of area to work with as a massage therapist. There's all these different donor sites. So a tram flap is the abdomen, a deep flap is the abdomen. And in a deep flap, the muscle isn't used, it's just the tissue from the abdomen. A C flap, not everybody can have that. It depends on whether or not you have, some people don't have the blood vessels there that they need to move. So, but that's the lower abdomen. A gap flap is in the buttocks. There's an I gap and an S gap, so upper or lower buttocks. Pat flap is the upper inner thigh. Tug flap is the inner thigh, and a lat flap again is the back. And some surgeons are very creative, and they will take part of the tissue from the abdomen in a deep flap, and then they will add a pat flap to it, and they will create the tissue by joining the two flaps together. So very creative, some very interesting outcomes, and a lot of areas for us to work on. So massage after surgery. Oh, this is a deep flap reconstruction, and you can see from her mastectomy scars to her outcome. And then she later went on to get the areolas and the nipples tattooed, and those scars faded quite considerably. So her outcome was actually not bad at all when she was done. She had a new belly button and everything. So really important for massage therapists to work on this tissue to help minimize the scarring. And going back to fascia, you can imagine with that much surgery, how much those fascial sheaths are impacted with any of this work. And one of the things that happen that people may not be aware of is that, think about the front of the body and then the neck area, how that gets pulled. So a lot of people get jaw problems and neck problems following these surgeries and don't really think to connect the dots as to why that's happening. So massage after surgery really does bridge the gap between a surgical intervention and post-op rehabilitation. I always ask someone to get a massage, to get treatment before they go for physical therapy. Physical therapy, typically you're sent to walk the wall. You run your fingers up the wall to see how far you can stretch and try to keep stretching it. And of course, there's a lot more things they can do. But if you get a massage first, it can release the fascial adhesions and reduce the swelling. So it makes physical therapy much easier and much more effective. Again, it can help minimize scar tissue formation and can help to increase range of motion. There's several techniques that you can use to help someone that's gone through this surgery. So manual lymphatic drainage, muscle energy, myofascial release, effleurage, of course, scar tissue mobilization, cross-fiber friction, massage cupping. I cannot even begin to tell you how effective that is, especially for someone who's not had reconstruction. It's invaluable. And then, of course, oncology massage, which I highly recommend you do take if you're going to work with this population. Maintenance massage after surgery can help to release those fascial restrictions and stop more from forming. It can help to prevent capsular adhesions that can happen around an implant. So it's really effective at helping to prevent that. It softens and realigns scar tissue, decreases swelling, reduces pain, eases anxiety, and improves range of motion. Biggest thing is it restores a feeling of normalcy. It is so fantastic once you start to feel like a normal person again, because believe me, you don't for a long time. You wonder if you're ever going to feel like you can move properly again. So these techniques are all beneficial after breast surgery, including augmentation and reduction surgeries. And if you're doing this with your clients, the result is going to be very happy clients. And the one comment I get from everyone, from most people, I should say, following this work is, I can breathe again. They're able to take a deep breath again. And that means so much. If you think about this area that you've been guarding and that's been so invaded, you don't want to breathe deeply. It's painful, number one, but secondly, it's like a body stocking that's had a huge seam taken out of it. It's very hard to be upright and then to get to breathe deeply again, which of course is very important for our health and for our lymphatic movement. So just the fact that they tell me they can breathe again makes my day. The next one is that they can hug the child again without pain. It gets me every time when somebody says, I lifted up my child and it didn't hurt. It's I get chills. I still do. I can do yoga again. I'm no longer considering having the implants removed. Pain-free again after surgery. The number of people that tell me they no longer take their pain meds. It's so rewarding. I can reach the top shelf again. And I have a story to tell about that, which I guess I'll save. But there was one lady, I worked on her. She'd had her surgery 7 years prior and hadn't been able to put her dishes away, hadn't been able to dress herself without help. And she was able to do all that again. So there's so many people you can help. And then one angry client who said, why is this not standard of care? I needed you 4 years ago. People don't know. If you start offering this work, please let it be known, because people don't know that they can get help. So massage therapists can play an invaluable role in helping clients promote and maintain healthy breast tissue, bringing awareness to changes that occur in the tissue and provide relief from the swelling, pain, and limited range of motion often experienced by those recovering from mastectomy or other surgeries. And there was a testimonial that was done after the research study, but I know we're short on time now. I think I might have gone over a bit. I apologize, but I hope you found this interesting, and I can always show that later when you get a copy of this. Thank you.
Well, thank you, Sally. And so informative, so much information packed in here. Deborah Solomon, that's on Zoom today with us, she does manual lymphatic drainage pre and post-op, and she agrees it's invaluable for these clients.
Absolutely. Absolutely. Pre-op too. Fantastic. Yes.
Yes. And I know you mentioned different techniques that can be used in addition to regular massage or as the massage. And you mentioned cupping, and I just wanted to know if you could expand on that a little bit.
Yes, absolutely. So cupping is reverse pressure, right? It takes the pressure off and it encourages fluid into the tissue. And again, going back to fascia, if the fascia is hydrated, it can stretch. It stops it clamping down onto the rib cage or onto that underlying structure. And it brings so much relief, because if it can stretch, you can move. So it's so important. I have to tell you, I have all my therapists go actually take Anita Shannon's classes. I have them sign up for that and get a really good understanding about cupping and vacutherapy.
That's great. And Anita has presented EDU-TALKs for us over the past couple of years. And to our audience, her EDU-TALKs can be found in the archive library on biotone.com. So please check out Anita's cupping EDU-TALKs. I see a lot of appreciation for your talk tonight. And I don't see any more questions, and I hardly believe it because there's so much about this. So let's say, I mean, my interpretation of hearing you is there is a huge opportunity for massage therapists to specialize.
Absolutely.
And bring awareness to this type of recovery, let's say, recovery help. it's also a great opportunity for therapists to build relationship with other professionals that are working with cancer patients and mastectomy patients and going through the recovery process.
Yes, honestly, it's other than to tell you, I mean, there was a research, I created this protocol, which is the one that they taught at Chopra and the one that I teach in my classes. There was a research study done on it by an occupational therapist. A.T. Still University in Arizona is the university that is actually publishing the paper on it. And it proved how much it can increase range of motion for somebody who's gone through this surgery. It's absolutely amazing. And we've presented it at the Occupational Therapy Annual Conference, which was in Kansas City in April. We're doing the Physical Therapy Conference, which is in San Antonio in September, I think it is. And I have people teaching this method all over the country, in the UK, South Africa, and also someone in Australia doing it now. So it really is beneficial. And I mean, it's, as a survivor myself, I can't tell you the difference it's made. I think I told you that just meeting that woman, and she'd been stuck for 7 years, and to be able to give her her range of motion back in one session, she was able to reach up again. She hadn't reached up in 7 years, and it only took 1 hour to give her that range back. So, you know, it's so needed, because I go into these little chat rooms where people say, you know, I've had massage and I've had mastectomy and I can't do this. Is it ever going to change? And I want to say, yes, it is. There are therapists that can help you with this. It doesn't have to be that way lifelong. But some people don't know about the availability, and they don't know that they will ever feel normal again. So I can't even begin to stress how desperate the need for this is.
All right. Some more chats came in, and excuse me, how can I get more training in this area? Our state prohibits breast massage without special training.
Right, without special training, but they can come get trained in the Spurgeon Method, and it's actually covered by insurance, well, in the UK as a modality in its own right. So it's gaining traction. Hopefully it will over here. But you can get training in breast massage. That's what we do. And it's 32 continuing education hours approved by NCBTMB. So there's your training.
Wonderful. And someone had asked, any classes coming up? And they can find this information on your website, correct? Yeah. And would you just mention your website to the audience, please?
Sure. It's Therapy LV. So THERAPIELV.com. And then you can go to the classes tab. And I just saw something in the chat. Can I address that one? Are you familiar with Deborah Curtis in Canada? So Judith 221, absolutely yes. Her book is what I found when I was going through all this. And a lot of the information that we teach in the class comes from her. I called her. She's so amazing. I called her up, had a wonderful chat with her, and she gave me permission to use excerpts. In fact, one of the handouts that I give at the end of this is an excerpt from her book. She asked me to just use it in any way I could to help other people. So I don't know if I expressed enough to her, short of breaking down and crying on the phone with her, to let her know how grateful I was to her for having put this material together, because without reading her book, I don't think I would have been anywhere near as comfortable with the subject matter as I am today. So yeah, she's phenomenal.
We have one last question that I see, which is, it's an excellent question. Would you try to promote this with clients, and how? And then second part, would you just bring it up or on a one-by-one situation? And even then, how? So let's say you have your egg carton of lemons there, and you notice something, and what do you suggest in bringing it up with clients? I guess you could market that you are specializing in breast massage and you've
You
received the
can.
training. Or, what would you suggest for the one-on-one?
So one-on-one, and especially if it's a client you're familiar with, even if it's not, depends on if you notice this, and you just open the conversation about, you can say, have you had your mammogram, or you can do any of that, but you can also just say, do you know how important breast massage is? And would you consider getting a breast massage? And then explain all the reasons that I did in the presentation there about the lymphatic system and how very vitally important it is for lymphatic fluid movement through breast tissue. So you as a therapist can either demonstrate a simple routine for the client to do for themselves, or you can actually learn these different techniques that you can perform even as part, you can offer it standalone or as part of a full body massage that you can do to help that tissue. And that's what it is. You're basically keeping that tissue healthy. So we have no problem bringing that up. Of course, people know that's what we do now, but absolutely, just bring it into the conversation. Let people know that you've discovered how important it is for breast health to do breast massage, and how simple it is to just do this routine every day, and then to incorporate it into your regular sessions.
And Meryl has the last question. Would you offer this to all ages? I am thinking about to elderly clients.
Yes. Yeah, I do offer it. The youngest client I've worked on that actually had breast cancer was 17. And then the oldest one that started coming for help with her breast, she'd actually had silicone that had burst. She was 86.
Oh my goodness.
So, yeah. And so, yes, absolutely, because there's always adhesions and there's always issues that you can help with to restore some kind of vitality to that tissue and increase the range of motion again.
Well, thank you, Sally. And just quickly, I would like to remind you all, tomorrow you'll receive a follow-up email. It will have a recording link to Sally's presentation. It will have 4 handouts, including tonight's PowerPoint, and it will have contact information for Sally. So if you have questions or are interested in learning more, taking classes, her contact information will be in the follow-up. And if you don't see it in your in basket, please check your spam folder. Now, also, note on your calendar, our upcoming EDU-TALKs. And recently in May, we launched EDU-TALK Diabetes Series, which has been, in the short few ones we have done, they've been excellent and sharing information. July 18th, we have the EDU-TALK Diabetes Series. RSVPs are open now. It will be with Adrian Asta, Adrian Asta, who's president of the Massage Therapy Foundation. And she'll present evidence-based research supports massage therapy for diabetic health. And that will be July 18th. July 25th, we have Marianne Cisco presenting cranial sacral therapy for post-concussion relief. And peeking ahead into August, Irene Diamond presents Maximize Earnings, Minimize Hours, Embrace Outcome-Based Pricing. And in August, the EDU-TALK Diabetes Series with Linda Lockett-Brown. She'll present Meal Planning for Diabetes, More Than Carbs. Watch your in-basket for invitations. Join us again. Thank you so much for your interest in tonight's presentation. Sally, it was wonderful, very informative. Thank you so much. And everyone be safe. Hope to see you again. And thank you for attending tonight. Take care.
Thank you so much, Donnell, and everyone.
Take care.